Typically, when we think of rotation of the hip joint, we think of it like this, wherein the leg is the most moving component, as moved by the contractions of the hip muscles that cross the hip joint. But if we're looking to generate this hip rotation movement, it's not solely about the muscles. It's also about the movement capacity or flexibility of the hip capsule and ligaments. The hip capsule and ligaments are non-rapidly contracting connective tissues that surround and bind the two bones together that, along with the synovial fluid, creates the actual hip joint. This final position is such that the femur is spun, whether inward or outward, and we get a rotational lengthening of the tissues. If the tissues won't allow it, just because we have strong muscles, doesn't mean we can generate the capacity for movement. So sometimes, instead of moving the appendage in the typical way, we have to reposition the entire body around the leg to generate this rotation. In this example, as given to us by Vernon Griffith, instead of the body being still and the leg moving, the leg is being held in a fixed position and the body is moving around that leg with the assistance of a weight. This means that the leg muscles that would normally move the hip are being mostly bypassed, comparatively relaxed, and the focus of the stretch effect is mainly on the hip joint and its associated connective tissues. If done well, it can create greater mobility at the hip joint, so that when our standard version of rotation is done, the muscles of that hip are more free now to move the hip joint and create meaningful, controlled rotation. Sometimes, you just gotta trick the body into working right.